Let's talk about money. You are the president of Lagray Finance, a diversified commercial finance company providing financial solutions to enterprises of all sizes in the healthcare sector and beyond. And when you were actually running your own manufacturing company, you raised millions of dollars for that project. So, do you have any specific recommendations for African governments as they think about taking that leap from that aspiration to actually implementing the Africa Pharmaceutical Business Manufacturing Plan and some of the things they could think about in terms of securing the funding that they need to have adequate investment?
One of the things that really surprised me when I started my fellowship at USAID was the amount of money that the US government actually puts into basic research, into medicines.
Yes.
You see things that come out and you think, oh, it's the company that did it. A lot of it starts right from NIH, where grants are given to academia and so on. What is the story of Moderna and the mRNA vaccine? Moderna got about $1 billion from an entity called the Biomedical and Research Development Authority. This authority is one of the newest agencies in the US government. It was created soon after the anthrax. I don't know if you remember, in 2001, somebody was mailing anthrax out. And it suddenly dawned on them that, hey, wait a minute, we just had, this was in October of 2001, 9/11 had just happened. That was a plane going into a plane, a physical thing, right? What if our enemies were to weaponize anthrax? What happens?
Yes.
Okay. Fortunately, they could find out, you can get Cipro and take it and so on and so forth. So they started thinking of, we need to protect the US in every way possible. And so this small agency was set up. And it was set up initially as what you would call a venture capital firm. It was meant to be run as the government gives it money, and this entity would now look for companies that they would invest in. Now, NIH and all of those and the NSF and all are investing in basic research. USAID and the State Department and all invest in things for HIV and all of those other things, right? That's different. Those are early stage. What they're now looking for are mature projects that are about ready to go to the FDA. Okay. And so they give a grant and then they partner, just like a venture capital firm. They now hire experts from industry, from everywhere, who sit with, once they have identified that this company is one that is doing something that is useful for us, we will work with them. We will not only give them money to complete this, we will get people from the FDA to work with them. We will hold their hands until it gets approved. And that's exactly what happened with Moderna. So they had the issue with Ebola. Remember, Ebola came into the US, and then there was Zika. This same organization handled all of that. The fear with Ebola was somebody ended up in Dallas who had Ebola. So money is put in by the government. In many cases, it may not come to anything. So there will be a number of investments that will not mature, will not go to market, but there are a lot more. And so that's how we have these mRNA vaccines today. It was government that invested in the basic research at the NIH. It is government that put in $1 billion into Moderna. It's government that has put money into so many things, right down to hand sanitizers and diagnostics and so on. If you go to the BARDA website, you can see all the things that they've, right now, since 2006, when it was set up, they've done, over 50 products that have been approved that are necessary. That if there is, this was a trial for them, this COVID-19.
Yes.
We all know that there will be other pandemics. I mean, realistically, anybody in the public healthcare field knows that this has just come to test us, and it shows us, and we should be ready for the next one.
It's a very interesting story. And Incidentally, the other day I was listening to Dr. Rockbright, I think, who is the former CEO of BARDA.
Yeah.
And he was talking about this ambition that African countries have to establish vaccine manufacturing and saying that it can be done because BARDA has actually done it before. It took them 10 years to establish egg-based vaccine manufacturing capacity in low and middle income countries with the H1N1 pandemic.
I'm going to frame my comments based on my experience in leading a global program while I was in BARDA, collaborating with the WHO, where we actually did this. We expanded influenza vaccine manufacturing capacity in 13 lower and middle income countries. And we did that in a period of 10 years, but that was based on building influenza manufacturing capacity in eggs, and including building chicken farms to lay the eggs and all the complexity of the capacity needed to make egg-based influenza vaccines.
And they recognize the importance of local manufacturing capacity from that experience.
Yeah.
And so we know the critical need to have local and regional vaccine manufacturing capacity. And that was the premise of this program that we launched back in 2006 across 13 developing countries.
So really, this has been done before. What Africa is trying to do, it has been done before, and that it can be done again. Another exciting thing, I think, is that Moderna CEO was saying that they're actually interested in the possibility of building a plant in Africa and exploring how they could make vaccines for yellow fever, chikungunya, dengue, and Zika, and how they could actually partner in Africa.
I've been having meetings in the last few months with my team and different leaders to figure out, is there a framework to build a plant in Africa, a Moderna plant? That's something very much of interest to us because we think first, COVID is not going to go away, unfortunately. We believe this virus is going to stay with humans and we have to learn to live with it. I think over time, when variants are going to stabilize with less people naive to the virus, it's going to be like over endemic situation. But there are many viruses that we are very interested in helping. Yellow fever, chikungunya, dengue, Zika. And so I really think the world would be a better place if we could find a way to bridge with COVID in the next 12 to 18, 24 months with existing manufacturing infrastructure. And then how do we build something in Africa that is there based on Africa soil, where we train people locally?
So I think there are a lot of possibilities here.
Remember that they've never had a drug before. This is their first one.
Their first, yes. It's a startup, right? Yeah.
It's a startup. So there is absolutely no reason why there cannot be a startup in Africa that would partner with any one of these companies and bring this technology. Absolutely not. So I think that the future for vaccines is actually bright. I believe that it'll work. Do we have the time now? I guess, well, if the Johnson & Johnson partnership with Aspen works, that would be a great one, So that's a good start.